Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning, Anita.
Good morning, Dr. Mencia. It's so good to have you back. I'm glad you went to New York, but I always worry when you go to New York, they're going to keep you there and we'll never see you again.
No. When I go there, make sure I pack just enough clothes to make sure that I'm coming back.
One pair of underwear.
That's it.
One pair of socks.
One pair of socks and one shirt just to fly back.
You have to have a different tie.
A different tie and a different shirt.
I'm glad
Same
you're not
suit.
colorblind because you match your clothing. You have I have to picture this, everybody. A lavender shirt, gorgeous, and a tie that's sizzling, has little flecks of lavender and gray. It is so gorgeous.
Okay, come to the office.
Yeah, come to the office. We don't care if you're sick. Just go to the office. If you are sick, you'll get well. But no,
we have a great surprise, Anita. You're gonna flip when you see what I'm doing in the in the office. You know, now we have two offices, one in Boynton Beach and Fort Lauderdale office. And the Fort Lauderdale office had been there, believe it or not. Well, you know, my daughter is gonna turn 18, so it had been there for at least 14, 15 years. And we built that building basically from the ground up. So it's a relatively new building, but it's now becoming a 15-year-old building. And it's time for some remodeling. You know, I just walk around the dental department and the medical department when I don't have a patient to see. And I see, like, how do I reinvent myself? What can I do to make things better? So you're going to see a very wonderful surprise in the dental department. And I took picture because I say, I don't know if Anita going to remember the way this is now. So I took picture the way it is when the last time you went there and the way it's going to be when you come back. You'll see a big difference. As a matter of fact, I was telling my manager that we should do a ribbon cutting or an open house or something.
Let's do that, yes.
Because it's going to be great for the patient. It's all for the patient.
Well, tell me about that. So when someone comes in and they have an aching tooth or they have problems, do they really see the environment? Yes, I know that's true. They do. But no, of course, you have people who've been there a long time and people feel like family.
Absolutely.
So whether it's pretty or not, they're going to go. But I do understand the environment for people to work in is important, isn't it?
Absolutely. And yesterday I have two staff members from Boynton, and one didn't know the other one was calling me, so it was like spontaneous. And one of the young girls that she had been a dental assistant, she called me and said, I just want to say thank you for everything you've done for me. And, that make you feel so good. Not
a lot of
like
people
a
don't
boss.
say things like that.
Right. Make you feel like more like a father now, more like a father figure.
Well, they want to come into the office. That's what's important, right?
Exactly.
So they bring their good feelings with them.
Exactly. I remember I used to have a manager. He was excellent. He was brilliant, like crazy. And sometimes he would come with this long face. And I would sit down with him. I say, this is what we do. This is life. This is like your family. So we didn't sleep together. So why are you angry? He goes, no, it's just something personal. I said, no, don't bring that here. We are a team here. We're a team. And the only thing personal is our patients. Everything else, we just work together. If something is that bad, just, it's time maybe not to come to work or let's talk about it. But don't keep it inside because the patient are going to see what I'm seeing. And that's no good. And I always do my meditation, early in the morning, and I do my meditation at night. and I try to be as bipolar as possible.
Maybe you ought to be doing maybe you ought to have some meditation classes there. I never thought about that before, but I'll bet some of your patients would come if you taught them how to meditate. Can you teach that?
Oh, yes, it's teachable. And the thing with meditation is that, it takes practice, like many things in life. You have to practice and then rehearse. Once you learn something, you might or might not experience the benefit of meditation. Once you do, then it's just a matter of practicing, because the experience each and every time you meditate is different. And I've been doing it for years, but the experience every time you meditate, every time is going to be a different experience. You go deeper and deeper into the meditation.
And years ago, meditation was for those people up in the Himalayas and other places. They were the gurus. But now it seems like a lot of people meditate every day, just the working people. And so there's been a secret now that has been found somehow.
Absolutely. And so much stuff you can do with meditation. We talk about the immune system, we talk about the heart and the lungs and the kidneys. And when we think logically, remember that logic is enslaved by knowledge. So the less we know, the less logical we are. So we have some knowledge of the human body, but when we look with the lens of honesty, there's a lot to be learned. Even with the DNA, to this day, they're still discovering more protein and more loops that they didn't know that were there, that they thought they were loops that were there to glue one protein to the other one. And they say, oh, no, these are real protein, and they might be part of the genetic code. So we're still finding so much stuff. And the body is so complex, how they communicate. Yes, we know that the heart is attached, and you have blood vessels, and you have nerves. But what about the spiritual part? How those things that we don't see communicate with each other? So, for example, before, you would spin the blood at a certain speed, and you were able to divide the red blood cell down and the white blood cell. You divide cells according to how much weight they have. So the thing that weigh the most will go deeper, and the thing that weigh light. But then they come up with a new centrifuge, it's called. And it's where you put the blood to spin it. And after we started flying to space and coming back, we found out, hey, we can do centrifuge with much higher velocity and more stability. So now we are doing fresh frozen plasma to inject back into people to make them better, their own blood.
That's the stem cell.
The stem cells. So taking people on blood and curing people with what they have, which means that most likely the answer in a lot of our problem is within us. But we keep looking outside. And sometimes, we go to the doctor and say, okay, you're going to give me something, right? You have to give me something. You have to give me a pill. Why? Well, I'm depressed, so you have to give me a pill. No, maybe the answer is within you. It's just a matter of you knowing how to activate that. And now we are learning that by centrifuging and taking that highly concentrated serum from your blood and giving it back to you. If it's a backache, we can take care of that. If it's a problem with the lung or with the heart, we can put it through an inhaler. You can put it back in you. Wrinkles, loss of collagen in the skin that give the expression of aging. We can take that back and fix it with your own blood, which is great, because if we're talking about holistic, we want our own thing to fix us.
So the meditation, let's go back to that. When you meditate, are you thinking and working on those cells? Or
Oh, absolutely. Because when, everything in life, you have to think of spectrums, the spectrum of how the brain cell communicate. What have we learned thus far is that when a person is severely depressed, you can take an electrical conduction and you can shock the brain, right? It's called ECT. And when we shock the brain, basically you're making the person go into a convulsion. It's a controlled convulsion because when you stop shocking the person, the convulsion will stop. And why do we, and it's so effective. ECT is so effective in treating depression. It's incredible. You know, you do ECT to people, they don't have to start taking a lot of medication for depression or anything like that. And some people that go into a very, very, very severe depression. You know, the only way to get them out is to shock, to electric convulsion therapy, ECT. And how does it work, we ask as scientists. And the way it works is that it takes the cells and it milk all of the content so that we force the neuron to communicate with other neurons. And the person sort of snap out of it and say, I'm normal. You know, I'm energetic. I can go and play golf again now. You know, I can go dancing. I can eat. I can sleep normal now. You know, I'm motivated to go read a book and do something different, you know, where when you were depressed, you have no desire to do any of those things. So just by shocking the brain, and that's one extreme. So the other extreme is meditation. And through meditation, you can basically bring the function of the cells of the neuron down to a level that it can put you into a coma close to going to sleep. You can take the heart and bring the heart rate down so that instead of your heart being tachycardic, now you're going into the bradycardic side, which means that it's below what people consider quote-unquote normal heart rate. And why is that important for the human being? Because the heart, as a pump, the lowest is the heart rate is, the better the pump is. The faster the heart rate is, the worse the pump is. So if a heart is pumping and you don't allow the blood to come from the lung into the heart and let it settle down and then push all the blood out into the system, if you don't allow the first phase to take place, when the heart pump is pumping half of the amount of volume of blood that it's supposed to be having. That's why a person that has a fast heart rate because of thyroid problem or anxiety or anything like that, they feel lightheaded and dizzy and weak because the pump is not working properly. And without proper movement of blood, there is less oxygen going to the different system, the brain, the muscle, and the person will feel lightheaded, the muscle will feel weak. And depression and many other conditions that we see, basically through meditation, we can, of course, many, practicing proper meditation, but we can take the heart rate and bring it down. We can take the rate of your breath per minute and decrease that. You can increase it also. You can also increase your heart rate through meditation. Your gut, you can dilate your gut so you have better bowel movement. Okay? Your muscle, you can relax your muscle so you have less tension. Less tension means more relaxation.
So what I have to do is say, you're listening to Dr. Andy Mencia. I'm Anita Finley, and we're talking about a lot of issues, but meditation, but it all comes from the AGI Medical and Dental Centers, one being, the main one, of course, is in Fort Lauderdale, over on East Commercial Boulevard, where Dr. Mencia is rushing there right after our radio show so that he can take care of all his patients. It's a very big Saturday practice now from I think you started this, 2 years ago? It wasn't, I don't even remember.
About 2 years, yeah, we started doing.
And also, they have a gorgeous, gorgeous new center in Boynton Beach off Hagen Ranch Road. By the way, I just found out that's where they have fresh eggs along Hagen Ranch Road. There's a natural little nursery. I'm going to go there and buy my eggs and buy some of the things. I'll tell Rosemary where it is.
Tell Rosemary.
I'll tell her. Right. Anyway, let me give you a phone number for the wonderful AGI Medical and Dental Center in Fort Lauderdale, because they're there jumping up and down waiting for you. It's 954-489-3600. 1345. You have to just call there and make an appointment if you can. If you have an emergency, just drop in and Dr. Mencia will make sure he sees you. It's 954-489-1345. Now, if you are homebound, and this is really important, there are people, and my mother was one of them, she could not get to the doctor. They have home visit services available. It's extremely important for those boomers listening. Don't let your parents or your loved ones vegetate in their home and get sicker, and then before you know it, you're going to lose them. So make sure you call, tell them the situation, and they will prepare for someone to come out there. I wanted to go back.
Homebound, it's important to tell people, homebound by definition is not a person that up to yesterday were able to go to the store. It's a person that as of today is unable to go anywhere. And I tell you this because when I went to New York last week, one of the patients that was calling said, my doctor put me on a water pill. And my legs are getting really swollen, but not the bottom of my leg, now my thigh. And my belly is getting bigger. And when my wife touched my back, she said my lower back is swollen. So I said, sound like you have ascites, which is when the liver is not functioning well, that fluid is accumulating all over your body. So I asked him, what kind of water pill are you taking? So when he told me, and he went to the hospital because his scrotum was getting too large, and he got scared. And he went twice to the hospital, interestingly. It was a long weekend, so he went twice to the hospital, 2 different hospitals in Broward, and they sent him back home with the same water pill he was taking. And he called me, and I said, no. Give me the pharmacy phone number. We had to call a different water pill. You're on the wrong water pill. So there's one called spironolactone, which is an excellent water pill to get fluid out when you have this type of condition that he was having. And then we send the nurse practitioner to go and make a home visit Sunday morning. And we were able, to turn this around very quickly. So,
That's what the home visit, then the home visit, as I said, and I've always told the story, and I hope that was one reason Dr. Mencia took this seriously, that my mother was just, she couldn't get out of bed. She had Alzheimer's.
A lot of people die prematurely because,
nobody sees them at home,
exactly,
Dr. Mencia.
Exactly.
And so as Dr. Mencia said.
And it's not the same when you go to a hospital. You might not bring your medication with you, even though we tell people, make a list of your medication. But medication is very dynamic. It's always changing. They always say, okay, we're going to take you off from this one, put you on that one. And the patients, they are not nurses and doctors. They don't know the difference. So,
nor do their kids, because that's the big problem. The kids come in, they don't know what they're doing.
I had a patient yesterday, a young girl, that came in. She thought because the doctor gave her a new cream that she's allergic to the cream. And she was suffering now for 4 days with shingle. And she thought it was just the cream, so she stopped the cream. She said, but the rash is not going away, so I want to use some steroid. I said, no, you don't. you have shingle. we got to treat you for shingle. So, it's and it was a young lady, and it was something mild, so she did the right thing coming to the office. She should have done it sooner, because now you are afraid of the consequences of shingle, called postherpetic neuralgia. But as we age, we can decompensate so fast. It's not funny. We can just decompensate. And I had a patient that very stoic and very stubborn lady this week. And she said, I'm 88 years old, and look at me, and I'm all over, and I don't need this. I go on my yacht on the weekend, and blah. And I say, God bless you. But doesn't mean that you don't want to be prepared. She doesn't want to talk about anything about getting ready, getting prepared. Like, those things will never happen to me. You cannot prevent death. Eventually it will come. And when it comes, those lucky ones die in their sleep. But there are many, 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 many people out there that will suffer in the dying process. And that's what we are there to prevent this suffering from taking place. And the only way you're going to do that is by being prepared for that. And, being prepared for the fact that we are going to decompensate, regardless of our age. You have people that could be driving to work or driving home or going to their synagogue or church or what have you, and get into an accident. One of my ophthalmologists driving to the synagogue got hit by a person, the drunk driver, and from excellent ophthalmology. And he ended up from driving to the synagogue to an intensive care to a nursing home, a young physician. Oh. So, life is unpredictable, and we have to be ready. It doesn't mean that we're going to be pessimistic and say, no, nothing good is going to happen. Of course, many good things are going to happen. But
I would like to go back to meditation for a minute as you're talking about this, because I think that through meditation, it could ease those travels that you're going to
Absolutely.
Right, but the big problem is you can say meditation, but a lot of people don't know how to meditate, Dr. Mencia. So what is your advice? How should they go? How do they learn to meditate? Is it something that you think that maybe we could, I don't know if people would come to your office if we did it at 5 o'clock and we had a meditation.
If we have a meditation section, yes.
You could teach people how to do this.
It's a process of meditation, and it's easy to learn. It's working with your environment, learning about what surrounds you. People have a lot of misconception of meditation, and they think, you block everything around you, you embrace everything around you, and you just make them part of the universe. So when the big truck or the train is going by, you just embrace it. It's there, and it will be there, even after we are gone. So we embrace everything around us. And once we embrace, that will bring peace and harmony between you and the universe. And then you start working more and more internally. So it's like an onion. You start going layer by layer by layer, deeper and deeper into the core of the onion. And it's a beautiful process. People that do meditation a lot, they usually end up taking very little medication or no medication in their lifetime. Because you look at a lot of the condition, and again, going back to the beginning of this program, remember that us as physicians, as scientists, we know very little about the entire universe, and we know very little about you as a universe. So it's a lot for us to learn, and us as scientists, we have to be humble to the fact that we're still in diaper learning more and more things. But meditation has been on for hundreds of years.
Yeah, people are going to have to learn how to do this, because I was very fortunate, and I took something called the Silva Mind Control course many years ago, and you may not know about it, but it definitely changed my life. And after practice, and practice is very important, after probably a few weeks, 3 weeks of, I could go into what we call an alpha state by counting down to 10, and then it's just what you said. You're there, but you're not there. You know what's going on, but you're not there. And I literally, at this point, can now walk through, sounds crazy, my people. Listeners think I'm crazy. I can walk through the wall. I could go right through there and jump to the next building in my brain.
Right.
I can move there. I haven't been practicing enough, and I should probably take the class again. But after 6 months, a lot of us could actually go into this state and tell you where you're having a problem in your body.
Absolutely.
Yeah, this is a wonderful, you didn't know, I never discussed this with you, but it made a big difference in my life. But we had to first learn about we did anatomy, we had to learn about the body, we had to learn about a lot of things. This was done by an engineer, Silva, Jose Silva, I think it is, many years ago, and that's how he started this whole organization. And maybe it's still around. I ought to take some of those courses again. But I truly believe in meditation, and this could be what you say. But someone needs help to do this.
Absolutely,
so we have to think about, maybe that's, I know we have an article coming now on podiatrists. But, we have that wonderful podiatrist who was here. He was terrific. And but
that would be a good article too.
I think on meditation. Yeah. I think you need to help me write that, because I'm not.
Okay.
That's
absolutely.
Really. But I think we ought to talk about maybe there is a way that we can find some people who do that and refer them. And
or that have been interested in meditation.
Well, all your patients should. I'm beginning to think that this is something that maybe you should include in your practice.
And it's interesting because I walk into a room and that's what I first do. I first connect with the patient. And a lot of time I tell my nurses, okay, don't take the blood pressure, because I can see this tension. I can see the cord there, don't take the blood pressure. Let me just talk a little bit. So we start talking and let the patient relax. And when I see the aura that I'm looking for,
then you know.
Then I say, okay, take the blood pressure.
Okay, well, we've run out of time. We always run out of time with Dr. Mencia. Thank you very much. Please go down and go to his office, his center on Commercial Boulevard. Call 954-489-1345. Thank you, Dr. Mencia.
Thank you, Anita.
I'm all revved up
and
after you. And
dental is open today.
Oh, dental's open.
And
get your teeth clean. Get everything done right.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.